Welcome to this Australian conversation. Can you introduce yourself to the patients and family and cancer teams watching and tell us your role for the new Proton service?
So my name is Yen-Ching. I am a consultant clinical oncologist, which is a type of doctor who gives radiation therapy, which I believe in Australia may be called a radiation oncologist. And I am the clinical lead of this project, which means that I have overseen the project from its inception, when it was just sort of plans on a piece of paper, to the ramping up of all the services required to deliver a successful proton beam service. And
we're going to be meeting members of your team as part of this conversation, and you're coming to us from different locations because we're recording this in the midst of the COVID pandemic, and thank you for joining us at this time. For people who just don't know about proton therapy, what is it? And what are the special characteristics when compared to conventional radiation therapy that we're more familiar with?
So I think the first thing to say is proton therapy is just a form of radiation therapy. The main difference is that rather than using X-rays, which is what we use in conventional therapy, we use particles, protons. And the reason for that is protons have a very special quality in that they travel through matter, so through your body, they treat your tumour, but within a few millimetres, they've deposited all their energy, so there is no exit dose, as compared to conventional therapy, which travels in, treats your tumour, but then there is an exit dose on the other side. So proton beam therapy, you can see, will irradiate less normal tissue. It still will irradiate some on the way in, but none on the way out.
And why is that such good news for patients and the people who love them?
There are two bits of good news here. The first bit of good news is for those patients who we already cure with radiation therapy, we may be able to reduce the burden of their late effects because we're...
And what are late effects? What does that mean, late effects?
So, for example, I'm a paediatric radiation oncologist. I mainly treat children and teenagers. And what I know is that we can cure many of these children and teenagers, but because of the treatments they've had, they have a lot of long-term ongoing health issues in and around, for example, growth, if we're treating a brain tumour, ability to achieve at school, problems with needing hormone replacements, depending on which glands we end up having to treat, fertility issues, and of course, anytime we irradiate any normal tissue, you have a small risk of many years later developing a second tumour. So all these sort of late effects can be reduced with the use of proton beam therapy. The other advantage of proton beam therapy is that for some hard to treat tumours, we are unable to get the correct dose into that tumour because the tumour is sitting right beside a critical structure, which is limiting our ability to give that dose. With proton beam therapy, we are more able to get that dose in. And so for that very small subgroup of tumours, we have a chance of increasing cure. But that is actually the smaller group of tumours. The main reason we use protons in teenagers and children is to reduce their burden of late effects.
So proton therapy has got great potential, but it's also very new. When does your centre open in London?
So our centre will open later on this year, and we're very excited about that opening. We're working very hard to get that date realised.
So really, the arrival of proton therapy in London, indeed the arrival of proton therapy anywhere, is a giant learning curve for the entire radiation therapy community. And I know you're going to be working closely with the Christie in Manchester, who are already offering proton therapy in the National Health Service. And we've interviewed them for this series. Just tell us the primary group of patients that the Christie and yourselves are going to be working with. Who will they be, and how will you cooperate in terms of data collection and research so you can monitor long-term the late effects for patients?
So the sort of patients we're treating are patients who have tumours in hard-to-reach places and children and teenagers. And the sort of tumours we are treating are tumours that occur in the brain, around the spinal cord, and in the pelvis.
And why are they the primary group that both you and the Christie will be treating?
So in terms of children and teenagers, the advantage of protons is this reduction in long-term side effects. For some of the adult patients, we struggle to get the adequate doses into these patients with conventional therapy. So I'm thinking really of the base of skull chordomas, chondrosarcomas, pelvic chordomas, chondrosarcomas. We are also looking at groups of patients that might benefit from protons, but the case isn't yet made. And the first randomized clinical control trial in protons has already started at the Christie, which is a trial called Torpedo, looking at the use of protons in head and neck cancer and comparing outcomes with conventional photon therapy.
You've raised that question of the evidence base, and can you just give us a nutshell assessment of the state of the evidence? Because there's still work to be done, isn't there, to be sure of the late effects benefits?
Absolutely. So a lot of the evidence for proton therapy in terms of late effects is modelling data in the first instance, but more and more data is now coming out from clinical practice. And we're very aware that within the NHS, we have a huge responsibility to collect this data. So the Christie and UCLH are involved in a common data collection so that we're collecting outcome data on all the patients we treat, both clinical outcome data, but also patient-reported outcome data, so that in time to come, we will be able to see what the benefits of proton beam therapy actually are, both clinically and from a patient perspective.
And when you talk about that patient perspective, my understanding, Yen, is that you feel passionately that while it is critical to look at the physical issues of long-term side effects and whether they're reduced by proton therapy, we also need to look at the psychological issues. Can you just speak to that? Why do you think that's important to study as well?
Well, I think that I have a particular practice in looking after adults who had treatment for cancer as children. And certainly there is a burden of there's a psychological burden for some of these patients in regard to the treatment they had before, which isn't necessarily directly related to the actual physical burden of their side effects. And 20 or 30 years ago, I don't think as a profession, as a society, we really looked at well-being and we really looked at psychological health. And I think moving on in time, we are looking at that more proactively now. And so my hope very much is that as we look at that more proactively now during the active phase of treatment, it may mean that in the future, the children and teenagers that grow up and survive their cancer don't carry that psychological burden any longer.
Just before I leave the patient groups that you'll be working with later this year with proton therapy, you've mentioned this Torpedo trial for head and neck cancer patients. I'm a survivor. 8 years today, as a matter of fact. My treatment began with radiation and chemo for oropharyngeal, tonsil, tongue and throat cancer. Why has head and neck cancer been chosen for the first clinical trial? Just in a nutshell.
I think that head and neck cancer patients, while outcomes can be very good in terms of survival, they do carry a huge burden of late side effects, and many of those are hidden, so you can't see them. So you don't see the fact that head and neck patients struggle to eat a normal diet because they have a dry mouth. You don't see that actually their voices may be more fatigued because we've irradiated that area, that their voice box and the things that help control swallowing. So I think that really this trial is trying to not only make sure that patients survive, because that at the end of the day is the primary aim of treatment, but they survive with a better quality of survival.
It's been absolutely charming speaking to you. Thank you so much for all that information. I think we'll meet some members of your team. Thank you.
Absolutely.
Beams now, and this is all set up with a lot of our quality assurance devices to ensure that the machine is delivering the beam exactly as we want it to deliver for the patients. So here we are in the Pro-Beam gantry room. This is the tabletop, the couch that the patient will lie on for their treatment. And for before treatment, what we'll do is we'll position the patients on the couch using some form of what we call a mobilisation. So this is something that helps to keep the patient still for their treatment in the same position. It's really, really important that the treatment is really accurate. So what I'm going to do is show you how the table goes up onto the gantry, but it very gently moves up and onto the gantry. The next step is for the radiographers to ensure that the patient's in the right position. And we use these green lights here, these laser lights, to help us to align the patient and exactly the reference point we want to use from which we want to treat the patient. When we're happy that they're in the right position, what we can do is take some images. We've got imaging panels on our gantry. So at this point on the floor, on either side of the gantry, this point and on the opposite side here, we've got X-ray imaging panels. And this allows us to take either 2D images of our patients, as if you were having a plain chest X-ray, or to do like a CT scan of the patient as well, to ensure that the patient's in exactly the right position, that we're happy that their internal anatomy as well is as it was when we planned the treatment. Once we're happy with everything, we can go outside the room in order to switch on the beam. And this gantry actually can move around the patient when we're treating to various positions, so that we can get the beam angle in to the areas that we need to treat. The actual proton beam itself comes out of this part of the beam, which is called the nozzle.
Well, it's welcome now to another member of the team at University College London Hospital NHS Foundation Trust in the Proton Therapy team. It's Laura Allington. Welcome, Laura. Can you tell us what your job is, your role, and what you're doing to contribute to the opening of this new proton therapy service?
Hello, Julie. It's lovely to meet you too. So I'm the operational lead for proton beam therapy at UCLH. I'm actually a therapeutic radiographer by profession, so I'm trained to plan and deliver radiotherapy and proton beam therapy for patients. But I've been in my current role as operational lead for the service for about 4.5 years now, although I've actually been involved in the proton beam therapy project at UCLH for about 5.5 years in total. So over the past few years, my role has been to help to implement the service. And that has been from designing and building a workforce, being involved in the design of the department, and to procuring the equipment that we are installing and have commissioning currently in our department. Going forwards, when we open later this year, I will be managing the staff that are working within the department. So we have a wide multidisciplinary team that I will manage. Predominantly a team of radiographers. There are going to be about 50 radiographers. But also within my team, I have nurses, health play specialists, an admin and clerical team as well. So a wide, diverse group of professions. So I'm responsible for managing the service, for ensuring that we'll constantly be progressing and evolving as well. So once we've opened, it doesn't stop there. We're constantly implementing and evolving new things.
The theme of this whole series is how do we improve the radiation experience for patients and families? And obviously proton therapy is a kind of radiation. Now, I understand that you engaged in quite a deep engagement with all different sorts of potential patients in order to consult them about the sort of service they wanted. So tell us what you did to consult, and then some of the practical results based on the recommendations from the people you spoke to.
So as you say, Julie, we've been engaging with our patient groups since about 2017. We've run a series of engagement groups that have met with the different age groups that we're going to be seeing coming into our department. As Yen has already highlighted, we're going to have a large proportion of teenagers and young adults and paediatric patients. But at the same time, we'll also be seeing about 2/3 of our service will be seeing adults too. So we've engaged with all the different age groups and looked at different aspects such as the design and feel of the centre. Accommodation, we'll be providing accommodation for patients when they come for radiotherapy. what activities do they want to do when they're in the centre as distraction and to make it feel warm and welcoming. And we've also looked at the provision of patient information, which is really important in familiarising them with the processes prior to them arriving in the centre, but also throughout their treatment to help them to manage their treatment and their side effects. So the patients really have influenced the design and feel of the centre. We're tucked below ground. We're actually almost 30 metres below ground in our Proton Centre. But what we've managed to do is to make it feel light and airy. And we've got a nature theme running through the centre, which was actually the idea of our patient groups. So they really have influenced the look and feel of the centre that they're going to be visiting. The feel of dappled light through trees has been one thing that we've tried to create in some of the areas. So we're very much making patients feel, hopefully, that although we're deep tucked in the ground inside, that they are actually connected with what's happening in the outside around them. So when it comes to accommodation, the groups that we consulted on were patients who had actually stayed away from home for 6 to 8 weeks of proton beam therapy, predominantly at Jacksonville in Florida. And one thing that came out crystal clear to us was that we really needed to create a home from home environment. Patients didn't want to stay in hotels. They wanted to have their own living rooms. They wanted to have their own kitchens so they could cater for their families. And they wanted it to feel homely. And that's what we've tried to create when we've gone out to procure the accommodation. A really important thing as well that we found out from our patient groups was they wanted to have a communal space. They found that when they were away from home, they got a lot of peer support informally from other families that were going through a similar experience to them. So as part of our accommodation tender, we've asked that we can provide that communal space for our families to drop in and meet each other and get to know each other and to get that support from each other.
Tell us about their requests for information and how you're meeting them, please.
Providing information starts very early for us in our patient pathway. And so we're trying to ensure that there are lots of different ways that we can provide information because, again, our patient groups told us that they wanted to receive sometimes paper-based information or information via an intranet. So there's lots of different ways that we're creating that provision. They asked for real-life photographs in our information booklets or on our website, so they could really understand the service that they were going to be visiting. And another thing that they also asked for was a patient app for our younger patient groups. And this is an interactive app that patients will be able to download onto a tablet or a phone, and they'll be able to create their own avatar and to visit the department virtually and to learn about the different treatment that they're going to be receiving and about the staff that they're going to meet. So really important as part of their play therapy and build up to a course of proton beam therapy for our younger cohort.
You mentioned the request by patients for a sort of a common room, a place they could come together. And I was just thinking when you spoke about professional collaboration, that sort of allows for patient and family collaboration, doesn't it? And I think Macmillan has got involved. Can you explain who Macmillan are and how they've contributed in London to a place for patients?
Yep, so Macmillan is a UK cancer charity that provides advice and support, among many things, to the cancer patients in the UK. And we're very fortunate to have gained some funding from them to create an additional space in our centre. It's called the Macmillan Living Room. And this isn't a waiting room. It really is a place where patients can just drop in and grab a cup of tea or coffee if they want to. There's a quiet space so they can just sit and reflect and be on their own if they want to. But there are also spaces for them to meet other patients and to get that peer support, which we've heard from our patient engagement groups is so important when they're undergoing proton beam therapy. It's also an area where they can gather information too, and they can use this space at any time during the day. And we will also, once we're open, run some groups from there. So we're looking at running some mindfulness sessions and some art activities, the distractions and activities that the patients discussed with us that they wanted to see coming into our centre.
Laura, an absolute pleasure to meet you. Thank you so much. Thank you very much indeed.
Thank you, Julie.
Well, our final team member from University College London Hospital's NHS Foundation Trust is Jessica Cantwell, and you are an Australian. Introduce yourself in terms of your job and your role in the Proton Therapy Centre about to open in London, but also explain your connection, I think, to Westmead, west of Sydney.
Hi, Julie. Yeah, you're right. So I am an Australian in London. So my role at UCLH is I'm the Paediatric and Teenage and Young Adult Specialist Therapeutic Radiographer. So in Australia, that's the job title is a radiation therapist. So my role here in London is I am the lead radiographer for the Paediatric and TYA cohort that come through for protons, as well as the radiotherapy service. And then, so my connection back to Australia and back to Westmead is that's the centre that I had trained in. So I'm a radiation therapist trained in Australia, and I worked at Westmead as a paediatric specialist radiographer there for a few years as well before I moved over here to London to pursue the interest in the sort of professional development as a radiographer working in protons. When children and young people do come through for radiotherapy, of course, it's quite a daunting experience. It's something that they're not particularly familiar with. So we do really offer a really tailored service to the paediatric and young people to ensure that they come through and they're very well. We have a team of play specialists that work in the department alongside myself, who, as a team, we all sort of work to make sure that the patients build a relationship with us first. We don't kind of rush into the technical mumbo jumbo that we're talking about. So we like to build that relationship first, and then sort of really, as the patient is able to sort of step into that information giving and a bit of a familiarization with the service, that we have sort of quite an extensive range of preparatory material as far as, video preparations and opportunities to see the machinery or see even some of the equipment. So we use a mobilization equipment on all of our patients, children and adults, and that is just a way to ensure that each day when the treatment is delivered, that the patient's in the same spot every day. So here, we can help the kids sort of experience making those immobilization equipments for their teddies or for their toys or for some toys that exist in the department as well. So it's a really inclusive thing as well for the patients to become involved in and hands-on, so that they kind of can feel comfortable before then those procedures are performed on themselves.
And can I ask you, Jessica, as a radiographer, or what Australians call a radiation therapist, do you work with the play therapist to build this relationship and engage in some of these activities, to show them the room, we call it the bunker, where the big machine is and so on? Do you actually get involved in that level?
Yes, certainly. So the children often are accompanied by myself as a radiographer or any of the radiographic team within the department. So, and that would be alongside our play specialist team as well, to go into the things like the CT scanner or into the bunker, just to give the children an opportunity to see how the machine moves, what the room looks like. I think quite often from a patient perspective, the bunkers and the treatment machine that we're using, there is a lot of images available on websites and things like that. But until you really go in there, it's a really nice experience for the kids to actually see what the machine looks like. So certainly either myself or other radiographers are in with the children and the play specialist team, allowing the children to sort of see how the machines work, and we can pop teddy bears and their toys and their dolls and things in the position that they would be laying in, and move the scanner and the couch top the way that it would move, so that they feel a little bit less frightened. I think children, if they are given an opportunity to actually see what's happening, it's hard to kind of imagine what they're being told by people until they can actually see it and imagine it for themselves.
Just before I ask you my final question, play therapists play a very significant role in the National Health Service in the United Kingdom. Could you just tell us about that role, and do you think they could be more commonly available in Australia? Just a little bit of cross-national comparison.
Yes, certainly. So the radiotherapy play specialist role, so they're qualified health play specialists, and we have a team employed in our proton and radiotherapy department, and their role is to really offer that support for the patients to ensure that there's no anxieties around treatment. They're also incredibly key personnel for our children and young people to actually educate them on radiotherapy. So our play specialists actually have a huge radiotherapy knowledge about the procedures, and their training is actually to see it from a children's point of view, and to be able to kind of advocate for the patients, that they might be able to see something that we as radiographers, to us, it's a very day-to-day thing that we're doing every day. For the play specialists, I think part of their role is really important, to actually kind of look at a situation or look at something, or really get to know a child and their anxieties, and actually say, do you know what, this particular child might actually find this procedure a little bit scary. Can we just maybe take a little bit of extra time? So they are a really key patient advocate to ensure that our children and young people do actually have a really nice, comfortable experience. So I would say, without doubt, I think there is a huge, huge opportunity for play specialist involvement in radiotherapy departments, not just in the UK and Australia, but kind of everywhere.
Do you use any small models of either the CT scanner or the radiation therapy machine, the LINAC, or the proton therapy machine to help educate kids?
Yes, certainly. So we have a few different varieties of sort of miniature equipment that the children can use. So that could be something, as simple as a Lego set that can actually be built to be made into a CT scanner or an MRI, or actually even a treatment gantry. We also have within the radiotherapy, so the conventional radiotherapy department has a mini LINAC. So when I say LINAC, the linear accelerator is actually the treatment delivery machine. So that is around the size that something a Barbie doll size could go on there, in where the patient actually would lie, and the children have got the opportunity to use the controller to move the gantry around in the position that they're going to experience. Within the Proton Centre, we also have a similar sort of piece of equipment, but that will be in the ProBeam, which is the actual proton delivery unit, as well as the MRI scanner that we're using in the radiotherapy department. So they're really great opportunities for those children to kind of get desensitized to what they're going to experience.
And the last question, which I realised I had never asked anybody as I walked into my bunker the first time, is, do you feel the radiation or the proton therapy? Do you feel anything while it's happening?
No, that is a question that we get quite a lot. And no, you definitely don't feel anything at all. So if you imagine that the protons and conventional radiotherapy alike are almost just like an X-ray in that, or a scan per se, in that you might hear the machine turn on, or you might hear a bit of a buzzing noise, but you won't feel anything at all.
Lovely to talk to you, and I hope we see you back in Australia sometime.
Thanks, Julie. Thank you.